If pharmacology is the bane of your existence, stick around for 1 minute and I'll explain to you how I teach students how to learn pharmacology. We need to assign keywords. So if you think beta blockers, you're going to think blood pressure. If you think TB drugs, you're going to think liver toxic. So start assigning keywords, okay? And that will help you so much instead of trying to memorize everything. So the big two we're talking about today is MAB and CEPT. If you see a drug that ends in MAB or a drug that ends in CEPT, these are two big, giant testable drugs. These two are major immune drugs. They will decrease the immune response. Therefore, it is very, very important that we report any infection. So as soon as you see MAB or CEPT, you need to think infection. It is so severe that if the patient has any indication of an infection, we will not even start this. So how might that look on an exam? They will say your patient has just been started on a MAB drug. Which of the following, if the patient reports, would mean that we would not start the drug that day? Patient reports dysuria and fever. Okay, yeah, we're not doing it. So you need to report infections immediately because their body will not be able to fight infection. It is so severe that it decreases their immune response that we have to do a TB skin test before we give a MAB or a CEPT. If they have TB and we start them on these, they will not make it from the TB. So very important that you have a negative TB skin test before you start it. Last thing is no live vaccines, because live vaccines, right, have a piece of the actual disease in them, whether that be the virus or the bacteria. So they cannot get live vaccines because their immune system will not be able to kill it off, and they will actually get the disease at which you are trying to vaccinate them against. They're the good keywords for MAB and CEPT. Infection, infection, infection.